In a previous video, we talked about simple meniscal tears, that is, linear tears with a horizontal, longitudinal, or radial configuration. In this video, I want to discuss more complex tears, and particularly to focus on meniscal tears where a fragment of meniscal tissue has become displaced. Now, sometimes this type of tear is very obvious, as in this case where there is a large fragment of the lateral meniscus has displaced centrally into the notch in a typical bucket handle configuration. And generally these are pretty easy to find. Some tears are a bit more difficult, however. This patient has had an anterior cruciate ligament reconstruction, and we can see a nice intact graft here. We can see that they've had a longitudinal tear of the posterior part of the medial meniscus. But as we scroll centrally, we can see that there is an abnormality at the rim of the meniscus, and as we scan further, we can see that there's a fragment of meniscal tissue that has been displaced posteriorly into the notch. And this is one of the characteristic places for meniscal flaps to displace too. So this is one of the areas that one must look very carefully to find displaced flaps. In this next patient, as we scan through to the medial meniscus, we can see that the posterior part of the meniscus is somewhat attenuated. It is smaller than is normally seen. There is potentially a good reason for that. This patient obviously has some cartilage damage, and it's not uncommon as patients get older that the rim of the meniscus becomes worn and attenuated. However, when you see morphological abnormalities, rather than simply conclude that this is an older patient or that there has been previous surgery, it's important to check for a displaced meniscal fragment. And in this case, when we look around the recess, in this case the medial femoral recess, we can see that there's a large fragment of displaced meniscal tissue. Here we can identify it on the sagittals. You can usually confirm a displaced flap by identifying it in both planes, but the fragments that are displaced into the medial or lateral recesses are usually much easier to identify on the coronal plane. Let's look at another patient. As we scan through the medial meniscus, once again we can see that there is an abnormality of the morphology of this meniscus. In this case, the body of the meniscus appears to be thinner. It's as though the lower part of the meniscal body is missing, and indeed that's exactly what it is. And in this case, we can see that the fragment has become displaced around the tibial rim into the medial recess. This is a very important lesion to find. Often patients with these small flaps are young and very symptomatic. And also the treatment is easier. Only a small fragment of the meniscus needs to be excised, leaving much of the meniscus and particularly its function intact. So these are satisfying both for the patient and the clinician in terms of symptom relief. So again, we're looking carefully at the morphology of the meniscus. We're looking to see whether there's any morphological abnormality, and we're using that as a prompt to look both in the posterior recess and the lateral and medial recesses to identify whether there's a flap lying there. In this last case, we can see that this patient has a simple horizontal tear of the medial meniscus, but as we scan centrally, we can see that there's blunting of the rim of this meniscus. And again, this is a very characteristic appearance in patients who've had surgery, but in patients who haven't had surgery, once again, this should be a prompt to look very carefully in the recesses to see whether a fragment can be detected. And here we can see that there's a small fragment of the meniscus displaced around the tibial rim. Now sometimes if these fragments are very small, they can be difficult to differentiate from surrounding meniscal attachments. But here we can see the two components of the meniscus with the horizontal tear in between, and a third component as it extends around the tibial rim. Just a final point in terms of displaced meniscal fragments, that unlike entities such as osteochondral fragments, which can become displaced and loose in the joint, meniscal flaps almost invariably maintain some communication with the meniscus from which they become displaced. And this is a useful feature which can help in their detection. So look very carefully for morphological abnormalities of the meniscus. And when you find them, look very carefully in the posterior joint and in the medial and lateral recesses to look very carefully for small meniscal flaps, because they're important lesions to find, generally easy lesions to treat, and very satisfying for both clinician and patient.